So as everybody gets settled in, I'll just do a quick introduction for our next session. My name's Jules Vio. I am one of the outpatient palliative care physicians here at UCSF, and it's my pleasure to introduce our session on palliative care education, where we'll hear more about innovations in teaching how we work together so we can help patients with serious illness to live as well as you can for as long as you can. A fundamental challenge that we've heard about today facing palliative care is simply the gap between supply and demand across all disciplines. Not only medicine, but nursing, social work, spiritual care, and so many others. And it's really important because the only time you get truly interdisciplinary palliative care is when we're all working together. A solution to that is a dissemination of palliative care principles and expertise across the healthcare workforce. So we better serve our patients, we do it sustainably, and we do it with a diverse team that looks like our patients, speaks their languages, and understands similar cultural and life experiences. So with the leadership of so many here, Carly, Hedieh, Mike, Allison, Paul, Tanya, Naomi, and so many others, we're committed to growing the field through dissemination of palliative care principles at UCSF and around the country through the grand rounds, primary palliative care education, the Mary Center, where we're developing palliative care knowledge, skills, and attitudes for professionals and lay people, family members and caregivers alike. And of course, as Steve refers to, the crown jewel, the fellowship program of training specialists in hospice and palliative medicine. So I look forward to learning more about all of these directions, first with, I believe, Hedieh, who's going to speak about our pre-med and medical student programs.
Thank you. Hello, everybody. Like Irene, I am also struggling with some jet lag, but any misspeak, I hope you can excuse me for that. I am delighted to talk to you all about our pre-medical and medical student programs for UIM students and students who have some other marginalized life experience. So first we'll talk about, I'm Hedieh. Hello, I forgot to tell you who I am. I'm one of the palliative care physicians and had the privilege of doing fellowship here. And I do inpatient palliative medicine, and I'm delighted to be with y'all. So first we'll talk about the current workforce demographics in medicine and in palliative medicine. We'll talk about the program aims for our two programs, the details, and our future aspirations. So who is underrepresented in medicine? What does that even mean? And so being underrepresented in medicine means having a lower representation or disproportionately lower representation in the medical workforce, specifically talking about being a physician, compared to your population's representation in the general population. So this pie chart on the right is for California, and it's the population of California being 40% Latinx, 35% white, 15% Asian and Pacific Islander, 5% Black, 4% multiracial, and while it's not zero by number, a very, very small percentage Native American and Alaska Native. And so compared to the makeup of the population of California, these groups are disproportionately underrepresented in medicine as physicians. Folks who are African American or Black, Filipino, Hmong, Vietnamese, Hispanic, Latinx, Native American, Alaska Native, and Native Hawaiian and other Pacific Islander. So important to note two things. One is that this disproportionate underrepresentation can be state-specific and also national. And so just as a subtext, why sometimes who is considered underrepresented can be different. And in palliative care, so this is data from 2017 from American Academy of Hospice and Palliative Medicine about hospice and palliative medicine physician workforce. Groups, folks who are Latinx, Black, and Native American or Alaska Native are considered underrepresented within palliative medicine physician workforce, which is similar to the rest of medical workforce. So with that background, our program's aims broadly are how can we work as an institution and as a field towards a workforce that better represents our patient population. And how some of those steps are, one, to increase representation of trainees from these populations, and to provide earlier exposure to our field so that when a medical student is at the point of deciding their specialty, when a resident is at the point of deciding their fellowship, should they choose one, they remember our field and are inspired to pursue it. And other than being an issue of racial justice, right, the profession of medicine, higher education, there should not be gatekept, right? There's the issue of social and racial justice, but also we know that patients and families feel like they have better communication, improved satisfaction, and actually more adherence in certain treatments when they have language and racial concordance and/or racial concordance with their physicians. So with that, talk about two programs. So one program is a summer program for undergraduate students. So this is for students who are in college, who are pre-medical, so they've chosen to pursue, they're planning to apply to medical school. And it has three different arms. So it's clinical shadowing, clinical immersion. There's mentorship, and also narrative medicine and resiliency. So it is 3.5 weeks long. It's a summer program. And the clinical shadowing is kind of like a mini palliative medicine fellowship. So a week with inpatient palliative medicine, a week shadowing outpatient palliative medicine in SMS and OPCS, and a week with home-based and facility-based hospice with By the Bay Health. They have didactics related to our field with many of the folks in this room. Spiritual care, social work, and palliative medicine. They attend some of the workshops in the Mary Center that I think we'll learn more about shortly, in advanced care planning, in poetry, in medicine, as well as just palliative care generally as a medical field. There's mentorship. So one, we know that folks who are underrepresented may come from backgrounds or families that they may be first to attend college or first to pursue medicine. And so mentorship is extra important and relevant for pre-medical students that we are targeting. So they are paired with one of our DPM faculty who are dedicated and interested in doing this. The aim really is for longitudinal mentorship over the course of many years, beginning with this program. And finally, they have a UIM and HPM series where they get to hear from hospice and palliative medicine physicians from underrepresented backgrounds from across many states, actually. Here in San Francisco, Dr. Romero at By the Bay Health, Dr. Moody from San Francisco General, and then one of my close mentors and colleagues, Dr. Morse, who is a palliative care physician in Navajo Nation with Indian Health Services. Ooh, is this working? Yep, still working. And finally, narrative medicine as a tool for resiliency throughout medical training, because as many of us here in this room know, medical training can be arduous and soul-sucking at some points. And so developing this tool early on that Pramita leads our pre-medical students through is incredibly important and very much welcomed. So we had our first cohort back last year, July of 2023. 2 students successfully participated, and one's applying to medical school currently with close mentorship from their summer program mentor. And another is their senior research assistant with plans to pursue a career in medicine and research, clinical research, who is also in connection with our program. We receive feedback from these students on a biannual basis initially, and then annually, as well as from the mentors. And so far, the feedback has been very much positive, that the program helped them gain knowledge about palliative medicine, helped them have clinical shadowing experience in different healthcare settings, and to develop reflective writing tools. They appreciated learning from palliative care physicians who are also underrepresented, and we provide a stipend that was an important factor in them being able to attend the program. I mentioned that specifically because it's not very common for a stipend specifically for a clinical shadowing program that's not research-based. Again, that's another issue of racial and social justice for students to be able to participate. And our other program is a summer program for medical students that Carly champions and had its first cohort also last summer. And it sponsors 2 medical students who have finished their first year of medical school to participate and contribute to a research project that's led by DPM faculty, get exposure to academic work in our field, get mentored by faculty for career modeling and ongoing medical school and beyond mentorship, and finally to get publication or presentation out of this research that they're contributing to that can help with their future training plans. They also have the opportunity to have clinical shadowing if they're interested, and also lots of didactic learning, ACP modules, online modules, and narrative medicine sessions that sometimes these 2 student cohorts overlap in. And so where do we go from here? Long-term aspirations, noting that our programs have been they're going to be running for only the 2nd year this summer, and we're delighted for that. 1 is expansion, 2 is having community inspiration, and 3, how to be agents of systems change. So the expansion of the programs, we are aiming to expand to include more students, more projects, and more mentors and shadowing sites. Currently, we are kind of limited to shadowing at Mission Bay and Parnassus, and we have lots of other sites that they can benefit from. Community inspiration. So overall, what a lot of students need is mentorship and community. And part of our goal is to have a community of graduates that can have peer or near peer mentorship. And it's also to connect them with the broader hospice and palliative medicine community. A dream of mine is for them to be able to, like all of our graduates, be able to attend AHPM annually, and for that to be something that we sponsor. Because I remember when I was a resident, and even at that point getting to attend AHPM, I felt a great deal of respect and community inspiration through the talks and meeting folks. And finally, to be agents of systems change. So we are collaborating closely with Office of Diversity at UCSF in order to change some of the structures that have limited folks' ability to join a career in medicine. One case study is one of our students who's undocumented. While he was able to participate in our program, for research or work opportunities beyond that, there were lots of red tapes, and he was not able to do that. So one hope is for us to be agents of systems change in these programs and beyond. And I think I went over time, and I apologize. Thank you, everybody.